worried. Be happy.
Hello to all of you conference attendees at the Global Autism Conference of the Autism Society of Greater Phoenix. Thank you for viewing my presentation, Don't Sleep on Physical Therapy, assisting kids with autism spectrum disorder to reach their maximum physical potential. As you can see, my uniform is pretty casual. I dress like this every day when I treat my pediatric physical therapy kids. I want to be colorful with shirts that have some sort of happy graphic to uplift kids. So this is my uniform. I am Nekita Sullivan, Doctor of Physical Therapy, certified yoga teacher, and certified health education specialist. So let's rock and roll. I am going to share a little bit of my physical therapy journey with you all. I was a 3-sport athlete in high school. My interest in health and wellness also led me to a career in physical therapy, as it encompasses health, wellness, and sports. I am also a proud graduate of Clemson University, the Medical University of South Carolina, Charleston, and American Intercontinental University. I have had the privilege of working as a physical therapist in multiple settings, including outpatient, inpatient, industrial, home health, geriatrics, orthopedics, sports medicine, continuous care retirement communities, which includes skilled nursing, assisted living, memory care, and independent living, and of course, also pediatrics. I am also a certified health education specialist, certified hand therapist, doctor of physical therapy, certified yoga teacher, and Yoga Alliance continuing education provider. I am most grateful to be the owner of Yoga Therapy Bar, a holistic physical therapy yoga studio in downtown Clemson, South Carolina, which provides a unique specialty of physical therapy and yoga for physical and mental health and wellness. So we're getting ready to get into the meat and potatoes. I am also most fortunate to have the privilege of providing pediatric physical therapy 3 days a week for kids ages 3 and older with autism spectrum disorder and other special needs, such as Down syndrome and developmental delay. Many of these kids are receiving applied behavioral analysis, or ABA, in an outpatient setting or in their home. I am on a therapy team with occupational therapists, speech language pathologists, registered behavioral technicians, or RBTs, board certified analysts, or BCBAs, and board certified assistant behavior analysis, or BCABAs. Several of the kids that we treat are nonverbal. Some have devices to help them communicate. Many of them also have difficulty dressing, toileting, feeding, and more. Several of these limitations require a combination of ABA, occupational therapy, speech therapy, and physical therapy. However, PT is overlooked at times unless there are significant physical issues, such as frequent falls or the inability to walk, requiring the use of an assistive device, such as a walker or wheelchair. I make recommendations to the ABA staff and parents often when I see kids sitting on the floor, propped up on their knees, holding themselves up with their arms, W sitting, tripping when they walk or run, walking on their toes, changing speed awkwardly with quick movements, and holding rails with both hands when they walk up and down stairs. Frequently, I will receive a response from parents, therapists, or behavioral technicians and analysts that Jake can run, Jake can jump, or I don't think Jake needs physical therapy. My goal for kids with autism spectrum disorder is for them to reach their maximal physical potential, which includes safe function daily at home, in the school, and in the community. I do not want kids with autism spectrum disorder to just get by. I want them to thrive. Physical therapy can help them reach their maximal physical potential. As a pediatric physical therapist treating kids with autism, I often notice some common physical limitations with their coordination, gait, strength, flexibility, posture, endurance, balance, and more. I will be demonstrating some of these limitations throughout the presentation. Many kids have core weakness in their spine, in their abs, abdominal muscles, and their hip muscles. The core muscles provide trunk stability. These muscles are the powerhouse, the foundation from which their upper and lower extremities operate. Core weakness can contribute to poor posture, falls, and difficulty with weight-bearing activities, such as crawling, jumping, running, walking, and standing, and even more. Poor sitting posture is most evident when sitting without back support from a chair. As a result of weak muscles, their seated posture may manifest as rounded shoulders and a forward head, which we as therapists know as kyphosis. Their ability to walk is often affected due to abnormal gait patterns, such as toe walking, uneven step length, abnormal base of support, and excessive hip internal rotation. During tasks that require weight bearing, it is necessary for kids to be able to maintain their balance to prevent falling, because falls can result in some serious injuries, such as fractures or head injuries. Posterior lower extremity stiffness and lack of flexibility often occurs in the hamstrings, in the gastrocnemius or calves, and the Achilles muscles. This is usually due to excessive sitting and a lack of stretching. It can also contribute to leg pain, poor standing posture, and abnormal gait patterns. Movements which require activation of multiple joints simultaneously is often awkward and uncoordinated. When kids move from one position to another, especially with activities that require changes in speed, this is when the uncoordination is most evident. Physical fatigue or limited tolerance to activity prevents kids with autism from being able to participate in activities that require sustained or prolonged participation. This inability to maintain positions can often lead to frustration and behavioral outbursts. Again, these are some of the most common physical limitations that I treat as a pediatric physical therapist to improve the function of kids with autism spectrum disorder. These common physical limitations affecting, again, coordination, gait, strength, flexibility, posture, endurance, and balance will manifest as difficulties in daily activities. So, I'm going to break it down, and this is where we're going to start doing some of the demonstrations. Poor core strength shows itself with a rounded spine and forward head while seated, especially without back support. Compensation is usually with hand support or crouched floor sitting on the knees, which is often a precursor to excessive hip internal rotation or W sitting. W sitting also contributes to an abnormal gait pattern with a toe-in posture, which we often refer to as genu varum. This abnormal posture may lead to falls and difficulty walking and running on different surfaces. So with poor core strength, if the kid is sitting in a chair without back support, often what you'll see is the rounded posture in the forward head because they don't have the strength to hold themselves up. And the same thing applies when they're sitting on the floor. So as you can see, Kermit's going to help me in just a second. So we'll move Kermit out of the way for right now. So if your kid is sitting on the floor playing, as most kids love to do, they don't have any back support, right? So what they like to do is sit in this position with excessive knee flexion, which is usually a precursor to W sitting. After they get tired of this position, they will eventually go here. You see that? That's what we call W sitting, and it requires a lot of hip internal rotation. So if this hip internal rotation carries over into standing, it will cause a toe-in posture, genu varum. If this excessive hip internal rotation carries over into walking, it can cause falls, as most likely they will trip over their feet. Normal walking or gait occurs when the heel makes contact with the floor, which is what we call heel strike at initial contact. However, a lack of flexibility in the lower extremities often manifests as toe walking. If the lack of flexibility is different from right to left, that contributes to uneven step length. So when we walk, normal walking means that when our foot contacts the floor, the heel is supposed to contact the floor first. Okay? Normal walking means heel strike at initial contact on the floor. All right? But if there is a lot of tightness in the back of our legs, hamstrings, Achilles, and our calf muscles, it may cause a crouched position in standing and walking. And an often way that these kids compensate is by toe walking, walking on their toes. Good. The lack of muscular endurance to maintain sustained activities will limit walking distances, standing time, and seated tasks. The frustration of not being able to continue with these prolonged activities can lead to behavioral outbursts when fatigue occurs. So say, for example, the kid is sitting on the floor playing with a toy. When their back muscles get tired, often what they'll do is lie down and start crying and screaming because they can no longer hold themselves up. The same thing with standing. Let's say they're standing playing with a ball, or they're walking with their parents or friends, teachers at school or in the community. Once they get tired, they may start whining, burst out screaming. They may collapse and sit on the ground or on the floor because they're tired. They no longer have the ability to continue that task or that activity. A lack of coordination shows itself most often with changes in position, especially when having to regulate the speed of an activity, such as running, jumping, climbing, and crawling. The arms may flail instead of moving in coordinated rhythm with the body. Their trunk may sway from side to side, or the trunk may stay rigid with minimal movement and rotation. So when we walk again, normal walking means that we alternate when we walk. Our arms and legs alternate, but it's rhythmical. Everything works together. So whenever there is a task that the kid needs to perform that changes speed, such as running, it won't be smooth. The rhythm, they will lose their rhythm. So, for example, when they're running, their arms may flail. When they're running, their trunk may sway from side to side, or the trunk may stay rigid when they're running, which limits their ability to run in a smooth manner. Again, these are just some of the common manifestations that I often see in kids with autism spectrum disorder. Physical therapy is effective. It's effective in helping kids with autism spectrum disorder improve their physical abilities. The focus includes stretching, postural and core strengthening, balance activities, endurance tasks, gait training, weight-bearing exercises, and alternating speed tasks. Core strengthening and postural exercises are done in different positions, such as quadruped, kneeling, and prone positions. So one of the positions that kids do not like is lying on their stomach. I call it tummy time. They absolutely hate it. So I have to make it fun. Oftentimes, I'll use competitive tasks with me as the competitor, of course, or we'll use toys. So for prone, when we are in tummy time, a lot of times I like to get them into a little bit of back extension. So this is when my yoga therapy comes into play, because this helps with spine extension, which is going to help them with sitting posture and standing posture, as it gives them more extension in their spine, and quite often they're rounded or flexed, either sitting, standing, and walking. So with complete prone, I try to get them all the way down flat. And from here, I'm going to give them activities that actually activate their back muscles so that they can strengthen their back muscles. So one of their most favorite things to do is airplane. And airplane usually gets them crunk. It really does. So sometimes I'll give them a toy to hold in their hands, but airplane means that their arms are extended and they have to lift up. So they have to use their back muscles to lift. And from airplane, they're going to move from side to side. They absolutely love airplane. Okay, so another one that I like to do in prone is called Superman. The boys love this one. So from here, I give them a toy as well. And yes, Kermit has seen better days. But we're going to extend. This is Superman. So without toys, it looks like this. And again, it activates all of the back muscles from your spine all the way down. So those are two very good activities to do in prone. From there, I like to use things in quadruped as well. So quadruped means we're on all fours. Tabletop is the pose that it's called in yoga. And one of the things I like to do here is a competition. So we'll either put a ball on my back and the kid's back to see how long they can hold it. And in order to do this, you have to have some trunk stability. Or I'll put a toy. And we've got to keep that toy from falling. So there are some activities in prone and quadruped. And for kneeling, we'll do some activities with tall kneeling, such as bouncing a ball. Or I will make it even harder by doing some unilateral kneeling, half kneeling tasks on one leg at a time. So we can either touch the ground with a toy. For the boys, we can bounce a ball, or we can throw a ball back to one another. And I need for them to be able to do this pretty well on both sides to produce symmetry. All right, so there you have tasks in prone, quadruped, and kneeling. Play therapy is usually utilized for seated floor tasks with toys such as sensory bends to improve sitting posture and endurance. Special attention is given to the lower extremities while seated to prevent crouch sitting on knees and excessive hip internal rotation, also known as W sitting, which we've already talked about. So one of the things I like to do is to get all of my kids sitting on the floor for floor play. With the play therapy section, I will always let them either choose a toy or I will give them a toy that they absolutely cannot resist. And usually what that is a sensory bin. So it will be a bin with rice, beans, and some sort of school-related tasks, such as alphabetical numbers, some sort of little toy, which is actually in the rice or the beans. And I will sit it right in front of them. I give them 2 rules. They cannot sit in a crouch position, which is the position they always go to most of the time, and they cannot W sit. So they can only do 2 positions with their legs. They can either sit with their legs crossed, or they can sit with their legs extended. And the toy is going to be placed right in front of them, and they will play with that toy. So what that's developing is their core strength, their ability to sit up, and it's keeping their legs straight and from internally rotating. One of my favorite, absolutely one of my favorite. In order to improve lower extremity tightness, stretches are targeted towards the hamstrings, the calves, and the ankles to improve flexibility of the posterior musculature. So this is when I use more yoga poses, such as downward dog and seated forward fold, to include stretching multiple joints simultaneously. So let's start with seated forward fold. So I will get the kid on the floor, seated with both legs straight. And if their calf, hamstrings, and Achilles muscles are tight, they can't even sit on the floor without bending their knees. So most likely what they're going to do is prop themselves up. So I usually give them a toy. And we're going to start with that toy on one knee. And our goal is to be able to get that toy as close to our ankle or toes as we can. So we're going to do that for repetitions and hold it. And we get to do it on both sides. I need Kermit to be able to do that on both legs to produce symmetry from the right lower extremity to the left. And then we've got to do it on both legs at the same time. So a level up, an upgrade from seated forward fold is downward dog yoga pose. So what we do is we go back to quadruped, all fours. Tabletop is what it's called in yoga. And what I explain to them is I want you to try to straighten your knees and get your heels as close to the floor as you can. So this is called downward dog. And you see how straight the ankles, the knees, and the hips are. And the heels are all the way to the floor. Two very good yoga poses to help with posterior leg tightness. Stepping blocks. The trampoline, soft mats, and uneven surfaces are used to challenge balance on a variety of surfaces. So, one of the things that can be done is using a toy. I use a lot of toys for balance. So if we are on a stationary even surface, I will do most of my unilateral tasks or more bilateral tasks. If there is an unstable surface and they're really showing progress, we will start doing some unilateral tasks. Just as simple as trying to stand on one foot and do not put your other foot on Kermit. And we'll time it because they like to compete. So I will be their competitor and we'll see how long we can stand on one leg. Once that gets to be pretty good, we'll start moving with it. We can start jumping. We can jump over Kermit, but we're going to challenge our balance on even and uneven surfaces. Stair walking is encouraged in most sessions. Toys are placed at the bottom and the top of the stairs to encourage stair climbing with and without a rail. I often walk in front of the kids as they are walking down the stairs if they have a fear of heights to obstruct their view so that their focus is on me. Quite often they will tell me, I'm afraid, I have a fear of heights when they're standing at the top of the stairs. So what I usually do is stand in front of them while I'm holding onto the rail. And as they take a step forward, I take a step backward until we make it all the way down the stairs. So I obstruct their view of the height difference, and their focus is on me and not on the fear of the height from the top of the stairs to the bottom. I often use tasks that will improve their ability to walk, such as marching, walking on uneven surfaces, and walking forward, sideways, and backwards. And I like to use a ball with these tasks. So lateral movement sideways are often a challenge. So one of the things that I like to do with my sideways walking is ball bouncing. Once they feel really good with just walking sideways, we'll do some ball bounces. We'll do some ball passes back to one another. Just a little way to make it more fun, more interesting, and include the lower extremities and upper extremities. Sprint races, climbing on objects at the playground, and jumping helps improve coordination with tasks requiring changes in speed. So one of the things I like to do for that is jumping. So we can jump over Kermit, forward or backwards. We can jump in a circle. Got to be able to change speeds. And outdoor tasks are utilized for long walks to improve endurance. So we're usually able to get some nature walks in. And that sort of takes their mind off of the distance. My ultimate goal for kids with autism spectrum disorder is for them to be able to function daily at home, at school, and in the community to their maximal physical potential and not just get by. I always focus my pediatric physical therapy treatments with that goal in mind. It is important for them to be able to sit on different surfaces, chairs, in the car, on the floor. It is important for kids to be able to walk on different surfaces in their homes and outside at their school and in their community with their family and friends. It is necessary for them to be able to walk up and down stairs without falling. It is significant for them to be able to play with their families and their friends, throwing, catching, kicking a ball, and riding a tricycle or even a bicycle. It is necessary for them to be able to play on the playground, which includes running, jumping, and climbing. And they also have the potential to play recreational team sports in their community or at their church. Their ability to do these everyday things makes life better for them and for their families and their caregivers and guardians. I often invite their family to participate in sessions for caregiver education and encouragement. I feel that it is my responsibility as a pediatric physical therapist to celebrate their wins, but also prepare them for difficult times that life is going to throw at them. Therefore, I need for kids with autism to know how to manage and to respond to the physical pain that often comes from a bump or a bruise or a scratch, or the mental and emotional pain that comes from a bully or lack of friends. My physical therapy sessions are holistic and also include health education and socialization situations so that they can experience and learn how to respond in awkward and uncomfortable situations. So I often team up with other therapists and their kids so that we can do group activities. It is an honor to be a pediatric physical therapist. I am most thankful that God has blessed me with the privilege to be a pediatric physical therapist for kids with autism spectrum disorder. Kids with autism and their families face overwhelming obstacles and challenges. So I try to give them a double dose of compassion, and I supersize it. And I challenge you all to do the same. Thank you so very much for spending some of your valuable time viewing my presentation. Don't sleep on physical therapy with kids with autism. Let's give them the best chance that they can possibly have to function physically and thrive. Thank you all for everything that you have done, everything that you are doing, and everything that you will do to improve the lives of kids with autism spectrum disorder and their families and communities. I am including my contact information, as you can see it on the screen, as my small business, Yoga Therapy Bar, has a website, email, Instagram, Facebook, LinkedIn, and Twitter platform. You all are most welcome to contact me if I can be of any service to you. It is easier and quicker to email me, all right? Info, I-N-F-O, @yogatherapybar.com. I am wishing you some love, some peace, physical therapy, and yoga. Dr. Nekita Sullivan. Have a great day.
Be happy.